Good evening all. I, Tanojni Mohanty, welcome you all to the 7th day of our webinar series conducted by JSS College of Physiotherapy, Mysore. It is my immense pleasure to introduce today's speaker, Dr. Bala Pillai. I can say Madam is the teacher of my teacher. She is board certified specialist in pediatric physical therapy with a doctorate physical therapy and with a special interest in autism spectrum disorder. Founder and director of Playground to Learn, New Jersey, USA, which provides advocacy and comprehensive developmental services for children with developmental disorders. She was an active member of the Autism Task Force initiated by American Physical Therapy Association and has provided several workshops on movement-based learning readiness program in New Jersey and India to parents and professionals working with children on the autism spectrum disorder. On behalf of JSS College of Physiotherapy, I am welcoming you, ma'am. It is our honor to have you address this gathering. Over to you, ma'am.
Hello, everyone, and thank you for that great introduction. It always feels nice when you hear your introduction. I want to thank Kavita Raja and her team for giving us veterans in the profession this platform to talk with graduating students, the future of our profession. It is such a unique idea to, give this platform to us where we can share our insights for all of you who are just about to enter the field. And, for those who are veterans like me, hopefully we also have a panel discussion. So I want to tell you a little bit about when and how I met Kavita Raja. I had just graduated from PGDR, that's postgraduate diploma in rehabilitation from All India Institute of Physical Medicine and Rehab in Mumbai. And I had finished that, and I remember when I was seeing my first cerebral palsy child, I was all so excited, so full of, all my neuro knowledge and all the primitive reflexes and the fact that I remembered them when I was evaluating the child. And I finished my evaluation, so happy I remembered ATNR, STNR, TLR, and all of that. And when I finished my whole assessment and feeling really happy about it, the mother, when she was leaving, she just touched my hand and she said, she said it in Hindi. I'm going to try and say it in Hindi because my Hindi was very bad to begin with. She was like, "Behan, mera bacha theek ho jayega na. Main bahut dur se aayi hu aur unke maa, like she was the mother and she didn't know how to make him feel safe. She said, I can't even carry him. He had a lot of extensor tone." And I looked at her and I sort of nodded yes, but it struck me that I really don't know how to teach her handling techniques. I knew the assessment, I knew how to do that, I knew what our physical therapy treatment was, but in teaching her how to carry her child and things like that was not something that I knew at that time. And so I went to the head of the department. He was Dr. Chainani at that time. And we had a nice relationship. So I could go to his office and I told him, I said, "Mr. Chainani, I just assessed my first CP child. And even though I graduated top of the class, I feel my education over here is not adequate because I don't know how to teach this parent handling techniques." So he was like, "Calm down. What exactly are you saying?" I said, "She wants me to show her how to hold him, how to make him feel safe. And I don't think I'm equipped for that." Of course, Mr. Chainani, he turned it around and he told me that you will have to start. He came back to me actually the next day and he said this. He said, "You have to do practical classes once a week to the incoming PGDR batch." And Kavita Raja was in that PGDR batch. So that's how I met her. And I would say that the belief that Mr. Chainani had in me, because when I, told him that I can't do it, he just believed in me and he said, "You can do this, Miss Pillai." He never called us by our first names. He said, "Miss Pillai, you can do it." And I was like, "Why?" And he said, "Because you have that connection." I never really understood what he said. I was like, this is just the easy way out. I came to him telling him, I don't know how to do this. And now he turned it around and he's telling me to teach the incoming students. But it was really nice. And I think it basically, that was the start of me always saying that the home exercise program is very, very, very important. We need to address the home exercise program. And I just want to give a shout out to All India Institute, because I was on fire. I was on fire when I was in All India Institute. The teaching staff and the leadership over there was so fantastic. And I think Kavita Raja is, Dr. Chainani will be so happy with everything that you're doing. So innovative, giving us this platform. Absolutely great. It was the place where, my curiosity, and I became a lifelong student. And it all goes back to my foundations in All India Institute. I have, I went to NYU. It couldn't hold a candle to All India Institute at all. I did feel the fire again when I did my doctorate with my neuro course. The professor over there, Dr. Arsenio Pays, was absolutely fantastic, and I felt that fire again. So it's really good. I would urge all of you, always be lifelong learners. It's worth it. Okay, so now let's get on to the program. And since coming here, I have opened up my own clinic. It is Playground to Learn. And I first started, it was open to adults and to children, but I soon realized that my passion was with children. And I shifted and I started working in New Jersey public schools. And it was a really good transition. Initially, it wasn't that great because I couldn't understand what the difference was between educationally relevant and medically relevant therapy services. And what that basically means is that whatever we do for a child, it should benefit the child from getting an education. So somebody should be benefiting from it. It's just not going and doing some medically relevant things for the child. An example would be if the child was finding it difficult to move from point A to point B, we made a team decision on whether it's worth it for the child to be learning how to walk from point A to point B, or is he going to use up too much of his energy and he's going to be too tired when he reaches point B. So we had to make decisions like that, whether it's worth working on what we would call the therapy, walking and all that, or should we just be giving an adaptive equipment and making sure that the child's posture is right and his energy is conserved for the reason that he's going to school, and that is to learn something. So it took me some time to make that transition, because I was so used to team meetings and, meeting with the parents. And in the school environment, it's not like that at all. You don't meet parents because the kids come to school and they leave. The teachers, are very well-meaning, but they are so overworked, they don't have time really to talk with you. And they think that you're doing something, taking care of the child medically, nothing to do with their education. And so it wasn't really built for that. And I really, really miss that opportunity. And I used to keep thinking, maybe I should go back to the medical environment. But, I was there for a very long time, and I realized that I love this opportunity because now I got a chance to see how the diagnosis really impacted a child in their natural environments. And it started a journey for me. So then I started understanding. So, what are the things that teachers were most concerned with? They had a problem if the child could not focus or they could not attend. They were not really concerned so much about their motor skills. Maybe the gym teacher, the PE teacher, physical education teacher was concerned, but not the teacher in the classroom. And how much time was she spending in telling them to pay attention? And that's where they needed help. And that's how I started getting very creative. And I started looking into how can I help? And I stumbled upon, movement-based learning readiness programs. And that was the beginning of that journey. Then the other thing is, how did I get so interested in autism? Because with all, my research and everything, I realized the importance of movement. And what I also found, and which I, spoke a lot about, is behavior is not a core or an associated symptom in autism, but the most concerning symptom that teachers have is behavior. And it comes more from the fact that they cannot focus and attend as much. And when they can't do that, and that's because of their autism and because of the different parts of the brain that's affected, their behavior gets affected. So it's completely preventable if people know how to support a child, and it doesn't have to be inevitable. So again, movement is the first teacher for a child. We always say it's a parent, and I'm a parent myself, but I would say movement is a human child's first teacher for subconscious learning. That's how they learn about their body. When we are born, we have no voluntary movement. It's all reflexes. But as we start growing, we start moving our hands and our legs in the supine position. Then we turn, we roll, we crawl, we explore. And that's how we start getting signals from a subconscious level about our body parts. We know that our hands and our legs belong to us. So that is our first teacher. Movement is our first teacher for subconscious awareness of our body parts and our body awareness, which is so important, and it is tied with self-regulation, which is tied with behavior. And that's the reason why, when I'm in the school district, people just don't understand how important it is for body awareness, that a child should have body awareness. I'm going to give you a very quick tip on how you can check that. You tell the child to do a stick figure, and if they don't draw the complete body, they have some form of neglect, or they don't have awareness of that part of their body. And when they don't have that, it affects their self-regulation. So, we need to go out there. Therapists, physical therapists, you have to do the education. You need to educate people. That's what I did. When I first joined the school district, even I didn't know what my role was exactly. School admin did not know. And when I started getting more and more informed on all the different foundations for self-regulation, I started giving PowerPoint presentations to administrators, and then they allowed me to see these kids. So we really have to go out there and carve our life out over there, our professional life, by improving people's awareness about what are the foundations of self-regulation. So what I find with the behavior was, I've been in this I was in this particular New Jersey school district for many years. I had the opportunity to see children when they started preschool all the way to when they graduated. And what I noticed was, especially, not so much for every child, but a child on the autism spectrum, their experience every year in the school was different. And it depended on the school team, the adults in the school team. And it really made me wonder, what is it? Because the teachers, of course, they loved what they did. They wanted to help the child. But why was it that sometimes, like one year, the teacher would say, this kid is fantastic. Second year, the teacher would say, I don't know why he's in my classroom. He doesn't belong here. Third year, the teacher may say, if I follow through with recommendations, he's fine. Another year, somebody may say he has started scratching and hitting and biting and things like that. So why is it, and even after that, again, maybe depending on who the teacher was the next year, they'll say he fits in very well. So it really, really depended on who the adults were in the child's life. And what I found out was, if the teacher was very secure, she knew her skill sets, then the child also was fine. If the teacher did not, or whoever was helping the child, or it could be even the parent, did not know how to deal with their behaviors or how to help them, then the behaviors became very bad. And again, I would just tell, this is for anybody. If any one of us, is in an environment where people don't understand you, don't know how to support you, and it's not just one day, it's every day of your life, you're going to start behaving in ways which are not too good. So I just want all the pediatric therapists and actually everybody to know that co-regulation is a very important thing. If you see somebody else getting frustrated or getting self-defensive or any of those type of behaviors, it's our job as healthcare providers to even make sure that we are calm first so we can calm them without using words, without using anything. When you are calm, and now when I talk about the polyvagal theory, you will understand exactly what I'm saying. So the polyvagal theory has helped so much. I can't tell you, it's nice to have a good, deep understanding of why we behave the way we do. So adult stress, like I said, definitely affects children. So if we have, teachers who are using their traditional disciplinary strategies, they wonder why the child is not responding. It's because those traditional disciplinary strategies just don't work. We need to connect at their level. And when you connect at their level, the child can, connects with you and emotes with you if you are calm, and then we can go somewhere with it. So what this made me, with all this information that I have, and especially because even I didn't know that we had a role in autism, it took me about, I was there in the public school system for about 15 years. I mean, the first 4 or 5 years, I did not think I had a role at all. And afterwards, I realized just what a huge role we have. And it's only recently that I realized that having a behavior approach to our interventions as physical therapists is a lot more effective. And I have actually created my own program called the Physical Behavior Approach. And I just hope, it's my heart's desire, especially, on a platform like this, to let you guys know that PTs have a huge role in autism spectrum disorder. And there is definitely a need for a behavior approach and, knowing how and putting self-regulation right in the center of it and how we can do it using movement. So just wanted to put it out there for you guys that we have a lot to do. So, okay, let's come to what is stress and why should we care? So according to, and I have to say I've got all my research data from here, from the US. So I'm sure stress is something we're all humans, we can easily apply it to the Indian population. So according to the American Institute of Stress, it is a condition or a feeling experienced when a person perceives that demands exceed the personal and social resources the individual is able to mobilize. So what it basically means is when our core beliefs and values or expectations are not met or it's not aligned with our core values, we feel uncomfortable. And if we are uncomfortable and we have our own resources to address that feeling of discomfort, then we don't get stressed. Or if we can identify, we can go somewhere else. We can go, we can maybe read up about it, or we can go to an expert. We know that we're going to be taken care of and we don't have stress. It's when we don't reach out to these things, to our own personal or social resources, that's when we go into chronic stress. There are many definitions of stress. I felt this went very well with how I understand stress and also with the polyvagal theory. So what is the number one cause of stress? Can you all tell me, can you all guess? I would love to see the chat box. I don't know how I can access the chat box over here, but the number one stress is money. Then comes work, then comes family responsibilities, and last is health issues. And I gave you my reference over there. So what are the top 10 stressors? You can see it's all around, family and work. So like death of a loved one, divorce, marital separation. I was surprised that even marital reconciliation was a stressor. So, I'm sure we all are very familiar with these things. What is the most stressed age group? I would love for you all to guess that. So the most stressed age group from these pictures you can see is 18 to 33 years. And the scale from 0 to 10 was 5.4. And the feeling that they had was they were not equipped to deal with stress. So I really feel this is something that everyone can, learning coping skills is one of the best gifts that you can give yourself. So have people died from stress? Yes, these are all the stress related illnesses. I just listed all of them. And so it's really important for us to address stress. So what makes us who we are? It is, like I mentioned, it's our beliefs, our core values, and our expectations. And how we respond to stress and to us is very, very important. And what makes us respond the way we respond is what I'm going to go in detail into today. We all have our stress relieving strategies. I'm sure all of y'all can list it. If I could see y'all face to face, I would have been asking all of you, please give me different ways in which y'all would relieve your stress. I've done this many times. People say we go for a walk, or we talk to somebody, or we read, or do yoga, do meditation. Everybody has their own techniques. But the one thing that most people struggle is they can't do all those things in the moment. If you are in a situation where everything was going well, but suddenly something happened, or you're having a conversation with someone and it's difficult. We've all had that experience where we've said or done something in the moment which we regret afterwards. So we all have our stress relieving strategies, but do we know how to use it in the moment? Do we have anything for the moment? So what is the polyvagal theory? The polyvagal theory is, if to break it down, poly is many and vagal is wandering. I mean, before polyvagal theory, I thought there was just one vagus nerve, but now I know that it's more than one, there are two. And so polyvagal theory is a collection of evolutionary neuroscientific studies pertaining to the role of the vagus nerve in emotion control, social connection, and fear response. So you can see how this is tied in so beautifully with the pediatric population. And I think with any population, if you are a service provider, a healthcare provider, I believe it is our job to make our patients feel safe. And that means it's emotional regulation, social connection, and fear response. It is the work of Dr. Stephen Porges. He is a distinguished university scientist at the Kinsey Institute, Indiana University, and professor in the Department of Psychiatry at the University of North Carolina in Chapel Hill in North Carolina. He grew up in New Jersey, so maybe that's another reason why I, love this work. But apart from that, jokes aside, the way he looked at the stress response is he studied the autonomic nervous system, and he looked at it from an evolutionary lens. So from the time we were vertebrates, so from amphibians to mammals and then to humans, and how the autonomic nervous system adapted as we evolved. So that is how he gives us a very good, thorough knowledge. And I'm sure we're going to have much better understanding later on. But right now, my understanding of the stress response has improved a lot more in knowing the polyvagal theory. So why do we behave the way we do? I'm going to be talking about all this. Obviously, it's connected to our stress response. So overview of what I'm going to be talking about is we're going to understand the role of the autonomic nervous system. We're going to know how we respond and why we respond, how polyvagal theory builds on it, and shift from a cognitive to a physiological management. So before I go any further, I want all of y'all to think about what is the stress response, and do you all know of it as fight and flight? And if that's the case, today's webinar is going to help you a lot, understand it a lot more. So why should we care about it? One, because it helps us to understand why we behave the way we do, to be aware that we have the choice of not allowing our emotions to control us, and to learn the foundations of behavior management. It's really a very great skill to have, for our own personal relationships, our professional relationships, and anyone who's doing pediatrics, it's a must for you guys. And the beauty of it is the neuroscience research is catching up with our ancient Indian culture of pranayama, yoga, and meditation. It gives me a lot of pride in saying that. You know, our ancient gurus knew what they were talking about. And for all the people who did not believe them, we now have research with all our fantastic brain imaging technology. We can now prove that whatever they told us is all true. Okay, so going to the autonomic nervous system, I'm just going to give you a little overview. It is our nervous system that controls our behavior. So it's divided into the central nervous system and the peripheral nervous system. The peripheral nervous system is divided into the autonomic nervous system and the somatic nervous system. The somatic nervous system takes care of the voluntary functions, and the autonomic is the involuntary functions, like the visceral functions, functions of our organs. So that is autonomic. And the autonomic has the sympathetic and the parasympathetic. The sympathetic sympathizes with our emotions. So when we are upset, it gets us ready to fight and to run away from there. And parasympathetic is calming. So when we are rest, digest, that's another nickname for it. So parasympathetic is calming. So over here, and most of our viscera has innervation from both sympathetic and parasympathetic. When the sympathetic gets triggered or stimulated, we go into a hyperarousal state. So our eyes are actually scanning for danger. Our heart rate goes up. We feel a dry mouth. We're trying to get in as much as we can oxygen, so our breathing rate goes up. It inhibits digestion, because obviously when you're going for a fight, you don't want to be thinking of eating, and it inhibits bladder contraction. So that is a sympathetic. And I also, for anyone who's a little bit more interested in details, is that it comes from the thoracolumbar area. And the parasympathetic has innervation to the same organs, and it allows salivation, it slows down the heart rate, it constricts the bronchi, it stimulates peristalsis and secretion, basically calming down the whole system. And the main nerve of the parasympathetic is the vagus nerve. It's actually, so over here, I'll just go to the sympathetic is from thoracic nerves 1 to 12 and lumbar nerves 1 to 2. And parasympathetic is 3, oculomotor, facial, 9th and 10th. 10th is the vagus nerve. And also the sacral nerves 2, 3, and 4. So anyone doing craniosacral, y'all are actually stimulating the parasympathetic. So it's not like, Dr. Porges was the one who explained everything about the stress response. The stress response was first described by Walter Bradford Cannon. He was a physiologist, and he introduced it, and he said that we have the fight and the flight. Whenever we are, stressed out, we either fight or we run away from the situation. And those working in pediatrics, I can see this very clearly in pediatrics, is that they first try to run away from you. And then when that doesn't work, they start showing signs of aggression, like scratching and maybe even actually hitting and biting and pulling. And I have seen this after a few years, they actually just withdraw. And this is just another part, just another slide of showing an adult feeling the same way. So this is Dr. Stephen Porges, and his theory really provides an explanation of how our neurophysiological states are selected based on our feeling of safety. So everything hinges around safety. So looking at it from a neuroception lens. What is neuroception? Neuroception is the nervous system function of always scanning for danger or threat. And I'm going to go into details about it here. So neuroception decides what is going to be the physiological state. And there are 3 states. So what does that depend on? On our internal environment and on our external environment. So what do we have in the internal environment is our body awareness, our homeostasis, basically how our organs are functioning. And external environment is co-regulation and physical safety. So that would be, when we engage our 5 senses. So this is what we need to remember if you're a pediatric therapist. This is what is the foundation of self-regulation in children. And I'll tell you why I'm breaking it down this way, because our brain matures and we don't have access to the higher centers when we are children. So this is what is the neuroception in children. And according to that, there are 3, so for children, there are only these 2 states. And I'll talk about the states again. But in adults, as we get access to our cortex, we have a lot of self-talk and past memories. And we also have access to another physiological state. What is the function? The main function of the nervous system is to keep us safe. Our survival instinct is the primary function of the nervous system. And he coined this, Dr. Stephen Porges coined the term neuroception. And it's our subconscious ability to detect threats, risks, and safety. And the most important thing is it's subconscious. We are not consciously doing this. It is like running in the background all the time. And knowing how to identify this is critical for us as neurotherapists. So the 3 states, what Dr. Porges says is that the nervous system decides it has a platform of these 3 states. The green, to make it easy for you, you can think of the traffic light. The green is safe, where we engage in social engagement. The yellow is go slow, there's danger. That's when we engage in fight and flight. And the last one is life threat, where we shut down and freeze. So you can see over here that it's not just 2 responses. It's not just fight and flight and go. There, he introduced us to the freeze response, which is stop. So once again, I'm just showing you how it's flight, fight, and freeze. And his work has given therapists who work with trauma cases a lot of insights, because, when a person withdraws, isolates, engages in self-destructive type of behaviors, it doesn't come under flight and fight. It comes under freeze. And so the physiology over there is completely different. So it's very important to understand that, and that's why it makes such a big difference. So I'm going to go into a little bit of detail about it. So we know it as sympathetic and parasympathetic. What Dr. Porges has told us with his research, and he's done, he's not just saying it as a theory. He's done the research on it, done it on lab animals, and they have actually used functional MRIs to find out whether these are the circuits that are being stimulated. So he says, he's brought it to us that there are 2 parasympathetic circuitries. The first one is the ventral vagal complex, and that is the myelinated ones, and that is seen only in humans. Then is the sympathetic nervous system, and that mobilizes us for flight or for fight. It can also mobilize us to do our work, and I'll go into that later on, and to play and things like that. And the most primitive of it is the dorsal vagal complex, and it's the immobilization system where we freeze and we go into withdrawal. So according to Dr. Porges, he says that it's the neurophysiological status that gives us a platform to choose any one of these circuits, and then we behave accordingly. And the most important nerve for the parasympathetic is the vagus nerve. And why is it so important? Because it connects the brain to the body. It's the second longest nerve in the body, and it's bidirectional. 80% of it is taking information from the viscera to the brainstem, and 20% of it is getting information from the brainstem back to the body. Now, to understand this a little bit more, I compared it to how we develop neurologically. So when a child is born, the child is born with the most primitive brain, which is a reptilian brain, and the function takes care of all the automatic visceral functions, and survival, of course, is the most important. Then as a child grows, the emotional brain, which is a limbic brain, starts developing. And at this time, it really makes a very huge difference as to how the child feels. Is the child feeling safe? What are the type of emotions they're feeling? And that is going to build the networks, whether the child is going to have more of defensive networks or feeling safe networks. So that shapes the structure of the limbic brain. And this is connected to the sympathetic that Dr. Porges talks about. And then you can see the biggest is the neocortex. And that takes about, our brains are completely developed when we are around 23 years old. So again, so that is connected with the ventral vagal, which is the myelinated parasympathetic. So again, the reptilian brain would have the unmyelinated, the most primitive parasympathetic. The limbic would be the sympathetic, and the neocortex would be connected with the parasympathetic. And if it is the parasympathetic, the fibers going back down to the body, that is completed only around 20 to 23. So, when we tell children to be logical, it doesn't work. We have to connect to them from their heart. We have to validate, and it's for any human being. But for children, when they have not yet developed their neocortex, it's really important that we talk to them on an emotional level and validate their emotions. Sorry. So the limbic, the neocortex starts developing around 13 years. And most of the children that we see, at least that I have seen, have, because I see the younger children too most of the time, is they are anywhere between, I would say most of them are between 1 and 2 years developmentally, and maybe 6 and 7 a little bit older. So they could be 15 years or 20 years, but have, some of them have, the brain has developed only till maybe 1.5 or 2 years. So we need to adjust our expectations. Imagine telling, it's like telling a child who's 1 year and 2 years to do half the things that we tell kids who are 14 and 15 years old. So if we just keep that in mind and knowing how their brain has developed and how much their autonomic nervous system, their stress response, how much that has developed would help a lot. So we need to know what our go-to strategies are, and that depends on how we have experienced life. If we have had more of where people have blamed us or shamed us or humiliated us, then we stay in the yellow zone. Our preference, our go-to physiological state would be, the yellow state, which is a fight and flight. And after some time, it may go into the red state where we freeze and we isolate. And if we have had the wonderful experience of being around very supportive people and we are, in a functional type of family dynamic or school dynamic, then our neocortex would be beautifully developed and we would have access to it very easily. So what is it that makes us go into the yellow zone or into the sympathetic fight and flight is when we have past memories which are negative. Then, like I said, blame, shame, humiliation, guilty. If we feel that that's what's happening, then we are automatically, I want to say that again, automatically we go into this. So, and the older, like for you and me, it would be the self-talk. If we tell ourselves, we cannot do this, this is too, I don't think I'm good enough. Your brain doesn't know whether you're good enough or not, but your thoughts are telling it that, and it's going to believe you. So please stop saying those negative things to yourself, because you can trick your brain and just say that, yes, you can do it. And you will achieve anything that you want if you believe in it. So, and the other thing that we do is we make up a lot of stories. If we see somebody turning away from us or making a face, we make up a story and say that person is not interested in me, or what I'm saying is boring. But today, hopefully you'll understand that it's not about you, it's about them and what physiological state they were in and how they went into that automatic response. So when you use your red channel, which is your primitive parasympathetic, you freeze, and very few people actually freeze, but isolate and, having suicidal thoughts, shutting down, not talking to anybody would be in the red zone. And when you're in the green zone, when you're using your cortical areas, you're using your myelinated parasympathetic, you're able to problem solve, you can get creative, you want to socialize, you want to play, you want to respond. So now remember how I said neuroception is, it's a scanning of the environment, which is the internal and the external. So again, since I'm more of a pediatric therapist, I'm going to be saying when children are, we're talking about infants, when they don't have so much of internal, other than, of course, homeostasis, and they're building up their body awareness, the external environment is extremely important. So neuroception of the physical safety and the people in the child's life and their ability to calm the child is critical. It is really critical. Now, this was really news to me because I would just work. I mean, I did it, of course, we just connect with the child, and I also, because I'm trained in other things like heart math and brain gym, I always knew that you have to be self-regulated when you're working with someone else. But this gave me a very, polyvagal theory gave me a very good explanation of why it's so important. So when a child is always in that fight and flight, they go into faulty neuroception, where they are picking up cues which are actually safe, but they are looking at it, the neuroception part of it becomes faulty, and they feel that it's unsafe. So social behavior will not occur when our neuroception misreads the environmental cues and triggers physiological states that support defensive mechanisms. It's like what is inside us. If I am full of love, I see love everywhere. If I feel that I am, like I'm in the fight and flight platform all the time, then I'm always going to pick a fight from, with whoever I am. It's like when you're pregnant, you can, you just notice all the other pregnant women. If guys, if you'll have a car that you'll like a lot, then you'll notice all those cars. If you just went and bought a Tesla, then you're going to be noticing all the Teslas on the road. So our perception really depends on what neurophysiological state we are in and which neural network we are picking up. So I'm going to, I keep going back to this because it makes a very big difference when you're working with children, how we talk to them, how our facial expression is, what our tone of voice is, all that makes a very big difference. And they're not getting anything when you're talking to them that way. So, let's just forget doing it like in that traditional way. Co-regulation is very important. Knowing how to give the co-regulation is also, of course, very important. And so what is co-regulation? It is an interactive process that helps a child self-regulate their emotions. Co-regulation is a cluster of specific actions by caregivers and others, which will effectively support a patient's ability to control impulses, organize behaviors, overcome obstacles, and complete activities. So this applies to everybody. It's not just for children. You know, we all are healthcare providers, and we want to create that environment where our patients want to achieve their goals and, you know, want them to overcome their obstacles. So it's really a good thing to know how we can do that. So while caregivers like teachers and coaches and other family members influence children's development of self-regulation, parents and primary caregivers are the most influential in building the child's capacity to regulate their own emotions. So this is where parent training is very important. As therapists, we are there maybe once a week for 30 minutes in a child's life. And the people who are with the child the whole time is the parent and the teachers. So training them is far more important than us doing anything with the child. I have seen miracles happen when I do it that way, without even doing much with the child, teaching the parent and teaching the teacher what can be done and making it as simple as possible for them. Making it simple is the most difficult thing. So, you know, fitting it into their schedule, into their routine, what they can do in their environment is really very important. And I'm just going to say something else over here. I always get this all the time from therapists in India, is that, Bala, you are in the US and you have access to all these equipment and everything. Let me tell you, in the school environments, there are some school buildings which doesn't have even a ball. Okay, when I first started, it was really very hard. You had to get very, very creative in how you can, you know, provide very effective, efficient recommendations. So, you know, feel free to reach out to me, because I can give you all a lot of ideas with no equipment at all. So anybody who says we can't do sensory without equipment, come to me and I'll talk to you. So this is, you know, just pictures of how self-regulation, co-regulation works beautifully in mammals. That includes, you know, animals. So you can see the dog and the lion cub, you know, they are walking very happily with each other. And we can definitely help by regulating ourselves. The one top center, you know, how the teacher comes down to the child's level, it's really very important. Neurology, the nervous system needs that. Humans need co-regulation before self-regulation. I'm also certified in heart math, which talks a lot about heart rate variability and the electromagnetic fields that are created by the heart. It's 5 times more than the electromagnetic field of the brain. And the vibrations, when we are in a positive energy, you can see is nice and smooth. And when it is rough and jagged, is with the negative energies. And when we are co-regulating, that's how we are sort of sending the vibrations across. I don't know if you can see this clearly, but you can see how we can affect the nervous system of a person who's within conversational distance from us. But they're now doing research for, you know, long distance impact too. But we definitely have the research now when we are within conversational distance. So again, to review this, our behaviors are dependent on the state that we are in, the neurological state, that neurophysiological state that we are in. There are 3 states we can be in. 2 of them are defensive, which is the red, the freeze, and the fight and flight. And the connected one is the green one. So we have 2 defensive and 1 connected. Depending on which state we are in, which is involuntary, we behave in that particular way. What does neuroception depend on? Our internal environment and our external environment. Internal environment depends on our body awareness and homeostasis, later on past memories, and the external depends on co-regulation and physical safety. Again, this is another review. I want to go over the polyvagal theory. They say it's arranged in a hierarchical way. The topmost is the myelinated parasympathetic, and that is the social engagement system. We are always engaged in this first. And the two functions are it revolves around safety. So whether we're stressed and not feeling safe or feeling safe. And according to that, the response follows. So like I said, the first one is the social engagement system, and it takes care of breath, heartbeat, our facial expression, and our voice. That's how we would engage to try and get the myelinated parasympathetic system stimulated. So if for whatever reason, the neuroception says that there is some danger, it sort of detects some threat, then we're going to go, there's first communication with the social engagement system. And if that is not satisfied, we then go into the fight and flight mode. So this is a sympathetic and it's a mobilization mode. So this is only when we are feeling stressed out. Like I said earlier, we first go into flight where we are running away from the problem. Then if for whatever reason we feel that that doesn't solve it, then we go into a fighting mode. And if that doesn't solve it, we go into the freeze mode. That's when we feel our life is threatened and we faint or we dissociate. Now, if it's a normal or if it's a safe mode, then we could engage in play, because play also is sympathetic because it increases the heart rate and the breathing rate. We could work with the sympathetic, but when it is in a safe mode. And we have positive, the difference is we have positive feelings and we have negative energy feelings. You can get creative and you have hindsight. So you learn from your mistakes. So this is where, again, the kids are, they learn from association, they learn from hindsight. You can't tell them to think about their actions, because if they are not yet 13, they can't do that. So, and remember, it's only around 23 that we can actually engage with the myelinated parasympathetic more efficiently. So if you have teenagers and, their nervous system is pruning and growing just like a 2-year-old. So just be a little bit patient with them. It would help. It helped me a lot in just understanding that, it's their nervous system that's making them behave that way. And again, the beautiful thing over here is when you can, in meditation, we are lowering our heart rate and our breathing rate. And that's when we are actually triggering the unmyelinated parasympathetic. We also do that during our sleep. So the fight and flight and work, art, play, and hindsight is when we trigger the sympathetic, which is associated with mobilization. And the primitive parasympathetic is when it's with a negative emotion, it's life threat. And when it's with positive calmness, it's meditation, and then sleep too. So this is a nice review of the polyvagal system. And there's another, fight and flight is things that children would engage in. Where as you get older, you maybe could get manipulative or sarcastic and passive aggressive. So those are higher, more mature ways of manifesting fight and flight. And the thing is, we can shift from one state to another state very easily. And that's what we should leverage. So each and every state can be interchanged. And that's what heart rate variability is about, is that the more quickly you can change, the healthier you are. So heart rate variability is tied with that. And, I'm just learning how to do all these things. So I did this last night. So it comes in a little bit late. Like I said, it's manipulation and being sarcastic and things like that. Lying, all that comes under, they're all ways of fight and flight. So it does give you a beautiful understanding of how the other person is reacting to you. So when you see somebody reacting that way, at least for me, that's how I've applied it personally, is if you see someone is, what I would just say in very, very simple terms, is being mean to you or unjust, then just know that they are triggering off their defensive mechanisms. And you can help them by just taking a pause. It's very, very, very difficult, but taking a pause, just sending them good energy, because if they are close within conversational distance, they will feel it, and show it on your face, a smile, being calm. And it does make a difference. It makes a very big difference. It's very hard, but it makes a very, very big difference. So again, I'm just, because I know they're students, I want to give you a review again. Remember, it's neuroception that will decide what physiological state we are in. So that's the environment outside and inside. That decides which state we are in, either it's in safety, danger, or life threat. And I, basically wrote what it would be under safety, danger, and a life threat. So we need to hack into our nervous system, and we know what the hierarchy is. You befriend it, because like I said, you can change from one to the other very quickly, but you can't be in both at the same time. You can't be feeling a positive emotion and a negative emotion at the same time, but you can shift very easily, and that's how we regulate. So be aware of the state you are engaged in, recognize, though, when I mentioned that it is our emotions that decide which platform we're going to be using, that is involuntary. But the first place that we feel that sense of threat or danger is in our body. We tighten up somewhere, we feel that gut feeling. It's there. We all have different ways or different patterns of the physical response to stress. And by identifying that, by learning to identify that, you can do something and shift from a negative to a positive easily. I mean, not that easily, you need a little, but at least knowing that you can do it. So that's the beauty of it, because neuroception is happening in your subconscious. If you go somewhere and you suddenly just feel that queasy feeling and you don't know why, it's because it's picking up something that is not safe for you. And you can become a little bit more vigilant depending on what the situation is. Of course, sometimes we get hypervigilant for no reason at all, but you will know what your go-to area is and then work on that accordingly. Deep breathing with a longer exhalation really stimulates the parasympathetic. So that's a very, very easy thing to do. And doing it with a positive attitude, like take a nice deep breath. Let's all of us do that together. Take a nice deep breath in. I'm going to do it for 4 counts. Now out for 4 counts. Now I want you to just soften your eyes and with a smile, take a nice deep breath in. And out. Now I want you to just say Om when you're breathing out. And if you don't want to say Om, you can say whatever you want, but you just want to sort of say a chant. You can say or whatever. Okay, so let's all breathe in. Breathe in. Om. So even doing it only 3 times or 4 times is a great way of getting your parasympathetic activated. So these are our takeaways from today's webinar: is emotions transform our physiological state. that is not under our control, but just knowing that it is our emotions. What is under our control is we can shift it from negative to positive. We cannot experience a positive and a negative energy at the same time, so let's shift it. We do have a choice. Do we want our emotions to control us, or do we want to control our emotions? And last but not the least, for all of us, but especially for the pediatric therapists, is know how to address faulty neuroception and co-regulation before self-regulation, which basically means a lot of parent and teacher training. So I want to conclude by saying that all of us are living our life story. Our life story is shaped by the things we say yes to and the things we say no to. And this is shaped by our beliefs, values, and expectations. How we emote and how we respond in the moment can transform our experience of stress. We have the choice. Do we want our emotions to control us, or do we want to control our emotions? Do we want to focus only on our patient, or do we want to build our own regulation, self-regulation, and co-regulation skills? When we acknowledge this choice, we create the biology of courage. And when we choose to connect with others in stress, we can create resilience. When we change our narrative around our stressors, we transform our experience of life. These updates in neuroscience has given me a whole new appreciation for stress. Stress gives us an opportunity to access our hearts, the passionate heart that finds meaning in connecting with others. And when we choose to view our stress in this way, we are not just getting better at stress, we are actually making a pretty profound statement. We are saying, thank you, God. Thank you for giving me this opportunity to find out who I really am. We are saying I can trust myself, or the inner guru or the jiva inside me to handle life's challenges. And we are remembering that we don't have to face them alone. The doors are waiting to be opened and explored. The choice is ours. Thank you. Okay, I can take questions now.
Thank you so much, ma'am. I think it's a wonderful eye-opening session and a radical session, I must say. And now we will take some questions. Now people have put, ma'am, the first question is, how do we assess a patient with severe stress and anxiety when the patient is not in a situation to understand or listen to what we say?
If they heard the whole, the whole webinar today, we don't have to use words. If they are not ready to, because first of all, we are not mental health providers. Okay, so that job is for them. But how does it impact us when we are working with them is we can see that they have shut themselves off. So when they have shut themselves off, that's when we understand that they have gone into defensive mode. And we need to address neuroception and our co-regulation. So neuroception is a thing by itself, like I gave you some things like breathing, meditation. Those are the things that it would be your job to sort of educate the family members and that person to do it, because it's when a person doesn't want to do meditation and yoga, it's a joint effort. So maybe the other family members can do it and this person could just be watching. So that's why it's neuroception and co-regulation. If you are going to respond to the way that person is by getting, going into your fight and flight, it's not going to help at all. That's an argument which nobody will win. So that's why it makes such a big difference that we address neuroception and co-regulation. So just, neuroception is your tone of voice, the way you're looking at them, the softness in your eyes, connecting face to face showing them that you are safe. They need to feel safe first. We have to do everything to make them feel safe. I don't know if I answered your question, but hopefully that has.
Thank you, ma'am. Ma'am, the second question is, will it help to eliminate functioning and non-functioning titles to children with autism so that we can be more inclusive?
I feel we need to know the diagnosis, but when we don't know the level, when we don't know which brain level they are, how much maturity is there, and that's when it becomes a problem. So the diagnosis and the label should be to tweak your expectations for the child, not to limit your expectations.
Thank you, ma'am. There are more questions. How do we identify whether a child with autism is masking?
Is masking?
Yeah, ma'am.
I didn't understand the question.
Sorry?
I don't understand the question.
Ma'am, they are saying how do we identify whether a child with autism is masking?
I mean, what do they mean by masking? They're saying they are not, they're lying? I don't understand what the question is. Maybe they can write to you again and we can go on to the next question, or the person can ask the question and I can be able to answer. I don't know if we have that capacity.
Then, ma'am, they have written the second question consecutive is masking seen in children with autism?
Yeah, I don't understand what masking is. I'm sorry.
Ma'am, please continue with the next question. I will get the reply to you. I'll get back to you.
Okay. Ma'am, they have the other question is, good evening, ma'am. Ma'am, will children fall under green stage all throughout their childhood?
Like I said, it keeps shifting. So it can shift, as I'm talking to you now, and if you just like raise your eyebrows or something, it's going to shift and it's going to say, oh, what is she saying? Is this like, is she thinking what I'm saying is not right? And then, like I said, the parasympathetic that's myelinated will tell me, no, she's attending to something else. And then I calm my system down. So it can be in moments we are shifting from one to another. So nobody is always only in one state. No one is always in green. Even if a child comes from a very, very functional place and is very neurotypical, they shift from one to another all the time. All of us keep shifting between the three states. It's like when you have to say something to someone, when you have to say to one person, the way you come across is very different when you say to someone else, because it depends on their physiological state, their neurophysiological state. Are they ready to listen to what you're saying? So we shift between different states very easily. It becomes a problem when we get stuck in a state which is a negative state.
Okay, ma'am. Then the next question is, ma'am, can schools cause sensory overload?
100%, yes. Yeah, schools do cause a lot of sensory overload. One of the most common things is the lighting that they use, the fluorescent lighting, is too much for the children. They actually have a buzz to it. So imagine hearing the buzz all the time. And then they have problems in screening out sounds. So it becomes too much of an overload. I just give you one example. The noise, even if children playing, the auditory levels become too much. And when you're on the stress mode, you actually block off human voice. And because you're scanning for threat, you hear the bass voice, the lower frequency, and the very high frequency is more. So it definitely, school environments, I think as therapists, we have a lot in terms of going and teaching them what they can do and making it as simple as possible. Yes. We can go on to the next question.
Yeah, ma'am. Then, ma'am, the next question is, can peer pressure be one of the cause?
100%, yes. Because the peer pressure can work both ways. Peer pressure can be if it is not aligned with your core values, and you do something that you don't believe in, then it is definitely a negative thing. But sometimes peer pressure is also positive. If they're encouraging you, then it's really very good. So it depends on how we see it. We have to always change the narrative in our head and the story and how we see things. But yeah, in younger children, peer pressure is definitely one of the things. Over here, the way we address it is we say if they have a strong foundation at home, then they don't need the validation from their friends as much. And it's easier for them not to give in to what their peers are saying. So the foundation at home is very important.
Okay, ma'am. So should we move to the next question, ma'am?
Please.
Good evening, ma'am. Ma'am, will children fall under green stage all throughout their childhood? Then in that case, will a sudden transformation in life drop them to other stages, and how will they face it all of a sudden?
Okay. Is there any way I can talk to the person who wrote this question?
Sorry, ma'am, that is
no. Okay. Yeah. Okay. So first, I want to say with children, I was saying that they are still at their emotional level. They are at their limbic stage level. So they don't really get to go into the green zone. They are, remember when I said sympathetic, it is positive and negative. When it is negative, when they identify threat, and this is when I say they, it's not consciously, it is the neuroception, which is unconscious. When the neuroception says there is threat, then it is fight and flight. But when it's not threat and they're feeling safe, that's when they can do the play and work and get creative, and they can even learn by their mistakes. So they are still in the yellow zone. But the yellow zone doesn't have to always be stress. It depends on whether it is safe or not, because both of them, remember, it is the emotion, it is a physiological state. In both states, in play and in fight and flight, the heart rate is increased, the breathing rate is increased. But when we are engaging in play, we are feeling safe. So always with children, we need to validate their emotions. With anybody, but with children, you validate it and then take them, address their issues. So they are usually not in the green state. They are in the yellow state, but in a positive atmosphere of feeling safe. I hope I answered that question. Does this person have a question? Did I answer it for them?
I will.
We can go on to the next one. We can go on to the next question.
Yeah, there are so many questions came up, ma'am. Then the next question is, how can schools support and develop experiences of relational exchanges, including repair, build, capacity, and experience in play?
I mean, they have to create an environment where the child feels very safe. So if the child is feeling threatened, it would be training their staff in recognizing it and knowing what to do. See, at the end of the day, everybody loves children. Anyone who's working with children, parents or teachers, they all love them. The definition of safety for children who have special needs is different. And, that would need them learning those skill sets. In another webinar that I gave, I used the acronym BRAVING. B stands for they need to know how to teach the child breathing and need to teach the child what boundaries they have. R is for resources. A is for an action plan. You need to have a proper action plan with step-by-step steps. V is for verbal cues, verbal behavior. How we give the feedback is very important. I is for making them independent. We should know how to wean our help. So the physical prompts, all that has to be weaned off because a child has to become independent to the level that they can. N is for neural regulation that today I spoke about. That was all about neural regulation. And G is for prioritization of goals. Especially in autism, we have so many areas that we can't address all areas at one time. You have to prioritize, and of course, safety is always the first thing. So knowing how to provide a safe environment is very important. That is like a 5-day lecture. Today is just an overview of knowing that you cannot deal with, especially I keep going back to autism, because if you know how to treat a child with autism, you'll know how to treat any child. So you need to know how to do that. Everyone says, yes, we love the child, we'll do anything for the child, we'll die for the child. My question is, will you live for the child? Will you live and learn autism specific skill sets so you know how to parent and you know how to teach? So that's very important.
Thank you, ma'am. Ma'am, the next question is, during treatment session, children cry out in pain or new environment. Will this lead to faulty neuroception to socialize and explore?
Yes. So again, for that, we can always, when it's a new environment, there's something called social stories, where you can tell the child beforehand what to expect. And you can use visual cues, pictures, and tell them this is where we are going, tell them what is going to happen. It is such a small thing that we can do for children, but when we do it and they know what to expect, then things are a lot better. So it is a team effort. It's never only one person. It's a team effort. All of us have to be doing that.
Ma'am, the next question is, one sets up, sorry for the interruption. Ma'am, the person who asked the question about masking, this is their explanation, but the next question is about. Tanojini, please go ahead.
This one, sir, that adult autism persons.
Yeah.
Okay. In adult autism, persons often mask, meaning they try to act like a neurotypical so as it to fit it. I was wondering if that was also seen in children with autism.
So I want to understand the question. You're saying that an adult with autism masks what they have autism so they can fit in with neurotypicals? Is that what the question is?
Yeah.
Okay. I mean, it is so sad that they have to do that. And they have to do that because society does not accept differences. And because we say we will accept you only if you fall into our realm of neurotypical. The very fact that this person has to mask that they don't have a diagnosis is, we as a society should reflect on it and say, why are we forcing them to do this? Because they have autism. It's like telling me, Bala, we will like you only if you have light skin. In India, light skin is a very big thing. So telling a child with autism, the fact that he even wants to be like a neurotypical is very sad. That itself is not creating safety. We need to learn how to accept people for who they are, because only when we accept people for who they are can we get their creativity and make their life experience as optimal as possible. It is very important that we understand that. I don't know if I answered your question, but yes.
Then, ma'am, the name came Sucheta. She mentioned, thank you so much for this wonderful session. Changed my perception about stress altogether.
Yay, that's very good. Okay.
Ma'am, one question from my side. How early we can predict autism? And is there any way or any therapy that we feel so if we will start from that age group, that intervention can be given so that any symptoms can be lessened in any way, ma'am?
100%. Now the average age is around it's come down to 18 months and maybe even less. I just want to give you a resource. If you go to the CDC, the Center for Disease Control, they actually have an app that you can get into your cell phone. It's free for milestone development. Okay, so parents can, and even therapists can have that in their app and check it to see if the child is meeting their milestones. And to answer your question on how early, it is the social reciprocity that would be missing. So when a mother's playing with the child, how we do peekaboo, and the child is not responding, that is usually your first cue. But you never go only by one thing. You go by a cluster of things. But that should be if you're calling out the child's name and the child is not hearing. Usually parents will say, I think my child is deaf or my child has a hearing issue. But that's not the case. So those are the initial signs. But the reciprocity and the give and take and pointing, children point when they can't talk to what they want. They won't do that. So those things should be a trigger. But it is a cluster. It's a cluster of symptoms that would say that the child is autistic. But what I tell my parents is just start what we do, because all the therapies, most of them are play-based. So you're not doing anything negative if you start the therapy and the intervention early. If anything, you would have helped the child achieve their milestones a little bit faster. So be always on top of it, because as somebody who works with children on the autism spectrum, my biggest challenge, I always tell, I could be the best therapist in the whole world. But if a mother or the parents are in denial and they want their child to look like a normal child, I'm not going to see any results, because they are in denial. And if you think something doesn't need attention, then you're not going to give it attention. So it's very important that they recognize, and teaching them, to accept that child for who they are, because you can really see a lot. You can bring out their inner potential only when you accept them. But if all the time we are comparing them to neurotypical children, we are doing them a huge disfavor. So, I'm sorry, but I find, I'm sorry to say this, but I find Indian parents cannot accept that their child is different. Most Indian parents, I'm not saying all, but Indian parents have an issue and they want their children to be neurotypical. And I think it is a journey. You have to go inside you to find out why it is that you can't accept it, because it's not the child, it is the caregiver. So we need to find out that. And like I said, if nothing else, you don't know what to do for your child on the spectrum, or any child with developmental disabilities, or any neurotypical child, just give them that sense of safety. Believe in them, and we will bring out their potential. So doing the most fanciest thing, but if you don't believe in them and you don't give them that sense of safety, and you don't keep comparing, this comparison is a terrible, terrible, terrible thing. Don't compare your child with anyone else. Just do what you can, so that relational and reciprocity and making them feel safe is the most important thing.
Thank you so much, ma'am. Ma'am, one more question, ma'am. As we know that the symptoms that persist throughout lifespan in autism, then ma'am, what happens when they go into adulthood? What happens to their marital status, then their educations and their job opportunities, and how far therapy can help them, and how far they should continue the therapy?
Okay. Very good question. I don't know. You have so many questions in that one question. And I am part of a group it's a parent group, Parent and Professionals for Autism. And it has really broadened my, because I work mainly with the younger children, 10 and younger. And these were all parents 15 and above. I mean, the children were 15 and above. And this is a group actually in Bangalore. And I can't tell you how impressed I am with them. Amazing, amazing set of parents, but most of them are doing homeschooling because they feel school is a terrible, terrible place for their child, because their self-esteem is so badly affected. But one kid is only 10 years old and he's a graphic designer, can't talk. That is the beauty of it, when the parents accept them. Another person who is an illustrator, digital illustrator for social stories for autism. Another one where the mother was here in Florida. She was a professor. She's gone back to India just recently. And nobody had told her the importance of movement. And she started, her son has motor symptoms, but for some reason he loved, they had told him over here to introduce him to dance. And he didn't like the dance here, but she had taken him to Tirupati and he saw Bharatnatyam. And next month is his Arangetram. And she said his math skills, this, that, everything has got so much more better. So these parents they have accepted their child for who they are, and they are using non-traditional ways of teaching them. So once we do that, see, why did I get so interested in autism is because I realized when I tell this child, come here, he doesn't understand that. Things like with cerebral palsy children and with polio patients, if I said, come here, stand up, sit down, they understood. But children on the autism spectrum, no. So I learned how they understand using pictures. So that's why my physical behavior approach, because I honestly didn't know what to do with them when I started. I did not know what to do. By getting into their world and how they understand is very important. So we can do a lot. So it really depends. I don't know about marriage, but I think for me, if I had a child on the autism spectrum, the first thing is making them as independent as possible so they don't have to depend on anybody, because that is, and the other thing in India is, which I find, at least when I came, I've been coming for the last 5 years very often, is the attitude is we have somebody to take care of the child. Arey Baba, how long will you do that? You have to have the child independent. So independence is the first thing. And then getting very creative in what the child likes. Actually, they always say in the Silicon Valley over here in California, 90% of the people are actually high-level autism because math skills, social skills are poor. We just didn't know it. So theirs is at the higher level. But we can do things, when you accept, everyone knows this. When somebody validates you and accepts you and believes in you, how you are with that particular person is who your true self is. So we can do a lot if we only accept, and it is our job. Do you know there's another Indian mother? Her name is Soma. She's I think she's a Bengali lady. Her child cannot talk at all, but she has this, I think it's called rapid movement something therapy. And her child uses, he writes the most beautiful stories by using technology. And we would have never known that because he can't talk. He can't talk. So it is our job to unleash the inner potential in the children. And it's a challenge. It's a challenge. The way we look at it, we have to look at it as a challenge and not as a burden. When we stop doing that, then there'll be magic.
Thank you so much, ma'am. Thank you so much. I think yeah.
Kavita ma'am is here. She wanted to speak to you. She was having trouble joining the meet, but finally she is here.
Hi, Bala.
So Kavita, shall I tell them some stories about you?
No stories. They've heard too many stories already. My whole reputation is in tatters, calling you people for webinar.
Oh my God, when I say that you're a shining star for All India Institute, where's the tatters in that? I can tell you this, Mr. Chainani will be very proud of you.
Oh,
I am so proud of you. I'm so proud of you.
Thank you. Hey, I look older than you. That's horrible.
Oh my goodness. Oh my goodness. Yes. If I had the guts to accept myself and say, okay, I don't have to color my hair.
See, Polyvagal should work for that.
I'm not yet ready. I'm not yet ready.
Okay, next time you're in Bangalore, you should come visit us.
100%, yes. And I also wanted to say, thank you so much for Kundan explaining the whole thing to me so nicely, so patiently. Kavita, it has been a pleasure. You know how I you know how I love students. So doing this with students and having this opportunity to, I hope I have made a little bit of a difference to the people who are just entering our profession, who is the future of physiotherapy. I have a lot of pride being a physical therapist. I hope you'll carry that torch and explore all the time and be like your Kavita ma'am. See how much she's done with her life.
There are no shortcuts to excellence. You have to keep on working hard.
But it's not hard if you love it. If you love it, it's not hard. So I wanted to tell you, when I did my doctorate, I was working full time. I had to work, unlike you guys who have servants at home to do cooking and everything. We don't have
servants to cook and all. Okay, that's your Bombay Ben Sahibs. We are all doing our own work.
Hello. My sister-in-law is in Hyderabad. They have a driver, they have a cook, they have an inside servant, they have an outside servant.
Okay.
I'm like,
I have only one servant and her name is Kavita Raja.
Yeah, you have to depend on yourself.
Yeah.
But and I wanted to say, like, I used to salivate to do my, when I was doing my doctorate, I would finish everything by 7 in the evening, and then from 7 to 11 or something, I would be doing my work and never even realize how much time I was putting. So once you have to find out what you like, and once you know that, it's not work.
Okay, Tanoshni?
Yeah, ma'am. It was.
We spoke about it before you came on.
We spoke about our topic, ma'am, also.
So thank you, Bala. Thank you so much.
You're welcome. Totally welcome. If you all have any other questions, and if you have a panel on autism, 100%, I would love to participate.
We'll keep you informed.
Take care.
Yeah.
And all the best to everybody.
Yeah, ma'am.
Wait. They have to say thank you and bye and all. Don't shut up.
Oh, okay.
Ma'am,
I just wanted to say one thing. If you love to give your website address to the question answer session, if some participants here want to speak to you, if there is any other way they can mail you. If you can leave your website address in the question answer session, the participants can pick up from here.
Oh, okay. They are going to, so my website is www.playgroundtolearn.com. So just remember playground. So playgroundtolearn.com. And you can
contact you on that.
Yeah, so it has my address and it's there on the slides for this PowerPoint. It's the last one. It's B as in boy, Pillai, P as in Peter, I, L, L, A as in apple, I, 92@gmail.com. No, at playtl, PLAYTL, playtl.com. I would love to answer the questions. Any questions, feel free. I would 100%, take the time and answer those questions.
Ma'am, thank you so much for your eye-opening and sensational session on polyvagal theory. Actually, forget about autism, ma'am. People like me also need it, like that Om you say, and this is actually very helpful, ma'am. And thank you so much that you are kind enough and to take your time to give us your knowledge on autism from your vast experience. Thank you so much, ma'am, from JSS.
Anything for Kavita Raja.
Thanks, Bala. Bye.
Take care and thanks for this opportunity. Really, thank you for this opportunity and all the best, everybody.
Yeah, thanks.
Bye-bye.
Thank you. Bye-bye. Have a good day.
You too. Good night.
Good night for us.